Duvelisib is a PI3 kinase inhibitor, but it's a specific inhibitor of the delta and gamma isoforms. So unlike the pan inhibitors of PI3 kinase, where there's problems with insulin metabolism and other off-target toxicities, these two isoforms are restricted to cells of hematopoietic origin. And that is the basis for the selective toxicity and efficacy of duvelisib. And duvelisib has been studied in a variety of hematologic malignancies, but is very promising in chronic lymphocytic leukemia and indolent lymphoma. One of the interesting things is that not only does duvelisib target the malignant cell, such as seen with the delta isoforms, but by hitting the gamma isoform, we're also hitting the substrate that allows for the survival signals to promote the growth of the malignant cell. So the Dynamo study was a phase 2 trial of duvelisib in patients with refractory indolent lymphoma. In this study, patients had to be refractory to both rituximab as well as chemotherapy, so a very, very tough patient population. We saw a 46% overall response rate as well as durable remissions of approximately 10 months in this patient population. So really good results. In fact, they met the primary objective of the study, which is to have a response rate greater than 30%. If there was a shortcoming of this study, I think is that we were hoping from the preclinical data and our phase 1 studies that the responses would be even greater. In reality, I think in looking at the patient population, these are very, very good results, and perhaps we were hoping for too much, but I'm really very impressed with the results. So currently duvelisib is being studied in the DUO trial, which is a randomized study comparing duvelisib to obinutuzumab. In this study, we hope to see that the PI3 kinase inhibitor duvelisib is superior to obinutuzumab. I think there's a lot more to explore. I mean, I think that we're just now understanding the full potential of this drug. I think that also help us better define the toxicities of duvelisib compared to alternative therapies. Because in these patients with indolent lymphomas and refractory chronic lymphocytic leukemia, there's a background of infectious complications and other issues that occur. And so through this randomized trial, I think we'll see in the next probably 6 months the results come out. I think it's really going to help us better understand this drug. In this study, we looked at the combination of polatuzumab vedotin in combination with obinutuzumab, the anti-CD20 antibody. Polatuzumab is an anti-CD79B antibody drug conjugate. The exciting thing about this study is we looked at it in patients with low-grade lymphoma as well as aggressive lymphoma, and 2/3 of patients who had relapsed and refractory disease responded, and about a third of these patients actually achieved a complete remission. So in patients with large cell lymphoma, that's really exciting data. Now, one of the Achilles heels, I think, of antibody drug conjugates so far has been the problems with toxicity. So you see problems with peripheral neuropathy. In this study, we did not see nearly the adverse event rate that we've seen in other studies with these antibody drug conjugates. We used a lower dose, and we capped the number of cycles that patients could get. And I think this turned out to be very, very important in making this a much more manageable and efficacious drug.